senators, Mr. Chair, and colleagues in the government, we were able to provide for September 15 to December 19, 2020, the benefit for actual hazard duty pay. We were able to obligate 3,357,000,000 po for 384,159 healthcare workers. Na this, of course, according to batas po, ito ay bibigyan lang po yung mga public healthcare workers po natin. For the special risk allowance, we have also obligated 3,211,000,000 for a total number of public and private healthcare workers na 306,314. And then for the provision of accommodation, meals, transportation, we were able to obligate 1,260,000,000 pesos for a total of 103,096 healthcare workers. Again, both public and private po. And then we were also able to enroll 32,281 public-private healthcare workers for an obligation of 16,300,000 po. Opo. So that's it for September 15 to December 19, 2020. Noting po that the Bayanihan Act 2 expired on December 19, 2020. However po, we know very well that that this was extended up to June 30, and we were only allowed by law because of that extension the granting of the special risk allowance, and therefore this covered the period December 19 to June 30 in the amount of 7,129,000,000 po. Again, for a total number of public and private healthcare workers na 379,117. So we have the list po. We can share and we can submit po according to regions by virtue of the data submitted by our regional directors po.
Excuse me.
Oh, sir.
Excuse me, Gloria, excuse me. Ano ang base figure niyang AHDB? Accommodation yan, di ba? Yan yung mga pamasahe. Ano yung SRA? Ano yung base figure na 306,000? Ilan yung bibigyan nyo? Ilang percent yung nabigyan nyo?
Okay, sir, ang AHDP po ay hazard duty pay po. Again, this is for purposes of giving benefits to people to healthcare workers, sir, who are exposed to...
I understand that. All I'm asking is simple. Listen to the question. The question is, ano ang base ng 384,000? Anong percentage ng kabuuan? Ano yung kabuuan yan?
Sir, let me share with you an initial estimate for planning po. As mentioned by Congresswoman Kimbo, we have submitted to the Senate, to Congress, a total of 517,356 eligible healthcare workers po. But this is really the total number of licensed health professionals all throughout the country, which would then not be all involved in COVID response. So ito po, sir, na-reduce po siya sa actual figure na ho namin na 384,159 because this figure po came from the master list coming down the ground po for health facility for each of our regions po. And these were submitted and consolidated by our regional offices. Yun po, yun na po, sir. So the actual number of health personnel who are, of course, public because it's...
Maylin, sandali lang, Maylin.
Yes, sir.
Yung 384,000 nyo, ang target nyo is really 538,000. Ikaw mo?
517,356 po. Yung
So, hindi nyo naibigay lahat yun dahil ang binigyan nyo lang yung nasa expose sa COVID. Tama?
Yes, sir. Tama po yun.
How do you explain na maraming mga nurses na nakikinig sa atin na nanonood na sinasabi hindi totoo yan. Hindi sila nabibigyan. Hanggang sa San Lazaro Hospital, tabi nyo na yan. sinasabi yan. St. Luke's, Lourdes, lahat sinasabi yan. How do you explain that?
Sir, can we also show you right now, with your permission, sir, the list of hospitals po and facilities
No, no.
for NCR?
Mr. Chair. Mr. Chair.
Yes, sino yan?
Villanueva, Mr. Chair.
Yes, Senator Villanueva, go ahead.
Yes, I'm afraid I don't want to miss that opportunity of that particular slide that she was showing us, Mr. Chair. If we can ask her to, because she's moving forward, I don't want to miss that, Mr. Chair, because in that particular slide, it says 7.1 billion was obligated. It was obligated. The total funding is 9 billion, Mr. Chair. So there's 1.9 billion unobligated. Bakit hindi na obligate ito? And also, Mr. Chair, let's point it out na obligated lang ito, hindi po ito disbursed.
Correct,
That means to say, hindi ito nagamit. Hindi ibig sabihin ng obligated nagamit. Is that correct?
With your permission, sir. Yes, sir. That's obligated. Ang
So, hindi pa nagamit.
nagamit po talaga disbursed according to our records is 6.93 billion po.
Okay, 6.93 billion ang nagamit talaga. But the total budget is 9 point something billion. Is that correct?
9.6.
Yes, sir.
May hindi nagamit. That's why it's kind of a tricky with that particular slide that you showed us. When you said, for example, you enrolled 32,281 dun sa life insurance. And I'm assuming nagamit po yun, na-enroll talaga sila doon. But dun sa sinasabi, obligated, hindi talaga nagamit. The fund is 9 billion. Ang nagamit is 6 billion. And this is emergency funds. I just want to point that out, Mr. Chair. Thank you.
Yes, tama yun. But again, hinahabol ko pa rin
Yes.
yung base figure na sinasabi niya. Dahil it collides with everybody that we're saying na Ultimo San Lazaro Hospital, hindi natanggap lahat. PGH, sinabi, hindi sila nakatanggap. Sino nagsasabi ng totoo dito? Kaya nga sinasabi ko kay Secretary Duque, alamin niya kung anong puno dulo nung sinasabi sa kanya, baka may nagsisinungaling sa kanya at hindi sinasabi ng totoo, di ba? Di ba?
Maylin po. Maylin, sir.
O hindi ba, Maylin?
Yes, sir. Opo. 9 billion po.
Collision kayo eh. Merong disagreement ng tao eh.
Yes, sir. Sir, yes, we were allotted 9.7 billion for this. We were given this amount released to us through ASARO on June 25. And we had to spend the whole 9.7 billion supposedly until June 30 po. So, ilang araw lang po yun. May mga kailangan ho kaming isettle na mga MOA, kailangan ho namin kausapin yung mga private sector, kailangan ho namin kausapin yung mga iba't ibang LGU hospitals po.
Yan ang sinasabi ko kanina kay Secretary Duque. Ang sabi ko, baka nahuling binigay yung pera, kaya hindi nyo nagastos. Oh, now,
Yes, sir.
na-realize na. Ibig sabihin,
Yes.
mabagal yung pag-release ng pera. By the time you na-release yung pera, hindi nyo na maghabol dahil hahanapin nyo pa yung mga tao o tumaas na yung presyo kung may bibiling kayo, kaya nagkakaloko-loko. Tama ba yun?
Yes, sir. Tama po
Kaya
yun.
binigay yung pera sa inyo, June 25, tapos
Yes, sir.
kailangan magagastos nyo in 5 days, magagastos nyo yun?
Yes, sir.
Ano kaya yan? So, yan ang rason. So, sino yun? DBM?
Yes. Friday, sabi mo.
Yes, sir. Sir, June 25 was a Friday. We had to immediately talk to our partners Saturday, Sunday po, nationwide. And of course, we had to spend this kasi po, sabi nga ho na ng batas, obligated and disbursed by June 30.
Precisely.
Yes,
So,
sir.
the inefficiency is within intra-government. Hindi mo nabibigyan ng DBM on time, tapos pipilit kayong tapusin nyo on a weekend pa, gagasusin nyo at i-obligate nyo in 5 days na may weekend pa. Tama ba yan?
Yes.
Yes, sir.
O, malinaw na sa akin yan. O sige, tuloy mo iba. Kasi ang hindi mo maipaliwanag sa akin, ay nagsasalita ang mga tao, matapang na ngayon, sinasabi na, uy, hindi kami nakakatanggap dyan. UP, hindi nakakatanggap. Gordon and Morris Olongapo, hindi nakakatanggap. Sa Baguio, di ba pa, hindi kami nakakatanggap. Eh, that collides with what you're saying. Kaya gusto ko malaman sino nagsasabi ng totoo. That's why I asked Secretary Duque, paliwanag mo kung saan magkakaroon ng pagkakamali. Please, go ahead. Tuloy mo na.
Tuloy mo na. I will do that, Your Honor.
Yes, sir. So, sir, yan po yung kabuuan ng ating benepisyo na naibigay noong September 15 to December 19, 2020, and then December 19, 2020 to June 30. Kung saan SRA na lang, sir, ang pwedeng maibigay. Yun po, sir. Sir, can I have an additional slide po just to show that we have some details po for Metro Manila Center for Health Development. So ito po yung
Excuse me na, Mary, no? You don't
Yes, sir.
expect us to take your word for it that just because nakalagay yan dyan, totoo ang nangyari yan. Kailangan patunayan nyo sa amin na naibigay talaga doon sa mga tao yan. Kasi malinis po konti sa sinasabi nyo.
Yes, sir. Sir, may mga memorandum of agreements po tayo with all of the private health facilities. And of course, certification coming from the chief of the health facility po, sir. So, with your permission, sir, kasi this is a data coming from CHD Metro Manila. Nabanggit na rin naman ho si Dr. Global Balboa kanina, Gloria Balboa po. Siya po ang pwede po nito, sir.
Just a moment, I see Senator Recto just came in.
Yeah.
Go ahead, Senator Recto. We will allow Mylene to continue, but you have a question in connection with what she's saying?
Yes, Mr. Chairman, thank you for recognizing this representation. But on the same issue, Mr. President, Mr. Chairman, we are talking about the benefits given to health workers, no? There are 8 benefits. So maybe when the DOH makes a presentation, let us complete the picture. There are 8 benefits under the law for our health workers. And we all know that the most important component in our fight against COVID is our human resources. Okay? And that's why we put in Bayanihan 1, Bayanihan 2, and in the budget for 2020 and 2021, more or less ang budget ng DOH is 540 billion. 2020, Bayanihan 1, Bayanihan 2, and general appropriations for 2021, Mr. President. No? So what are the 8 benefits? Para kompleto sana yung presentation ng DOH. One, napag-usapan dito yung actual hazard duty pay. Okay? The second is the special risk allowance. So yan, napag-usapan na rin yan. But then we put under the law also mandatory testing for our health workers. No? We also have tax-free compensation for public and private health workers who have contracted COVID-19, 1 million for disease, and I think that was incorporated because of Senator Gordon, 100,000 for severe and critical, 15,000 for mild and moderate. So ilan ba yung tinamaan ng health workers natin at nabibigay ba ito? No? Free hospitalization for public health workers. And then of course, provision of PPE for all our health workers, life insurance, accommodation, transport for public and private during state of national emergency and so on. So basically, there are 8 benefits, no? Yan ba naibigay natin lahat sa ating mga health workers? So thank you, Mr. Chairman.
Thank you. Thank you, Senator Recto. Now, very important. I want, Mylene, no? Pagpatawad mo. Pag tinanong ko ang nurse ngayon, pag tinanong ko si Jocelyn, pag tinanong ko, sino pa yung iba mga gusto magsalita? Ano sasabihin nyo ngayon pag sinabi na hindi totoo yan? Sige na, talangin natin. Jocelyn, totoo ba yung sinasabi? Umabot ba sa inyo yung sinasabi ni Mylene?
Yun nga po ang problema. Yun nga po ang problema, Honorable Chair. Napakarami po ang mga nurses at iba pang manggagawang pangkalusugan ang hindi po talaga nakatanggap ng mga benepisyong mga nabanggit. SRA, Active Hazard Duty Pay, hanggang sa ngayon. Nandito po kasama natin ang Pangulo ng Alliance of Health Workers, si Mr. Robert Mendoza.
Okay, Robert Mendoza, you're recognized. Anong sasabihin mo?
Okay, maraming salamat po, Mr. Chair, at saka sa lahat ng mga nandito po sa ating webinar po. Pwede kong i-present yung sa lahat ng mga hospital sa government na kung sino yung nakatanggap ng SRA, kung sino ang hindi, para pwede kong i-share po itong ating PowerPoint presentation.
Yes, may pinakita kanina yung hindi nakatanggap eh. Pero pakinggan mo, Mylene, para tama yung sinasabi mo. Go ahead, make it quick please.
Hindi po, paano kaya i-share to? Wait lang po. I-share ko lang po. Lang po Okay, share lang po ako.
Sir,
Ano po?
Mr. Chair, may
Yes.
info ulit, sir. Sir, hindi pa ho ako tapos mag-present. Can I still be given the opportunity to present siguro 2 more slides, sir? Before Mr. Robert will show his...
I will allow you to do that. But sige, in fairness to you, we will listen to you and show it. And then Robert,
Yes,
ihanda mo, hindi ka pa naman ready to say, present mo, ready mo na kagad. Go ahead, Mylene.
Maraming salamat po ulit, Mr. Chair. Sir, ito yung gusto ko lang hong i-present yung timeline. I think these are very important dates that we need to share with everyone. Na-point out na rin ho kanina na may lags ho in some areas. And I take note po of Senator Recto's comment po on the 8 benefits, but I'm just zeroing in ho doon sa 4 po, plus ikalima ho yung compensation na slide ko ho mamaya. So this is the timeline po for the granting of healthcare workers benefits that's due for granting September 15 to December 19, 2020. So with the indulgence of everyone, I will walk you through some important dates. September 11, the RA was signed, and DOH requested for 32,369,000,000 po to cover our health-related responses po, including the granting of healthcare workers benefits. On September 17 po, we were given an approved appropriation of only around 13,401,000,000 for health-related response, including healthcare workers benefits. So kung titignan po natin, honorable senators, we have a difference of around 18,732,000,000 from our requested funding of 32.3 billion po. And then on September 25, we were able to meet with DBM on the submitted details of the breakdown of the 13.5 billion, wherein DBM also presented their own proposal po for SRA and AHDP. And then on October 27 po, we received a letter from DBM on the advice of SARO amounting to 20,575,000,000. The 13.5 billion of which is part of this po for health-related responses, including granting of healthcare workers benefits. And on November 16, 2020, there was an issuance coming from OP on AO 35, again for hazard pay, and AO 36 on special risk allowance. And then on November 25, DBM DOH issued a joint circular number 1 and 2, so as we will be guided by we will be guided on the implementation of all these healthcare workers benefits. And on November 26 to 27, we have already downloaded funds to our various centers for health development, DOH hospitals, and other concerns. Noting po that the Bayanihan Act 2 at that time would be expiring on December 19, 2020 po. And then another slide po, Sir Chair. Again, this is the timeline for our healthcare workers benefits that are due for granting from December 2020 to June 30, 2021. again by virtue of the extension of the Bayanihan Act 2. So on April 8, sir, as you can see sa slide po, we sent a letter request to DBM for funds for SRA and active hazard duty pay funding for the provision of these benefits amounting to 16 billion pesos po. And then May 5, received a letter from DBM denying the request for funds for these benefits due to lack of legal basis daw po. So forcing the DOH to appeal to the Office of the President to issue policy on the continuous granting of these benefits po, particularly SRA and AHDP po. And then on June 1, 2021, AO42 on the special risk allowance was released by the Office of the President. On June 16, 2 weeks after po, DBM and DOH had to issue a joint circular prescribing the amended guidelines on the continued grant of the COVID-19 SRA to public and private health workers directly catering to or in contact with COVID-19 patients during the state of national emergency. So again, naayon ho sa batas po yun, Mr. Chair, na gaya ng sinabi ho nyo kanina. And then on June 25, that same day, we received the SARO po from DBM and only for 9 billion pesos for special risk allowance. Again, our request was 16 billion to cover both EHDP and SRA, but we were given, of course, 9 billion for SRA only. And then right on that same date, we processed sub-allotment guidelines. We talked, syempre po sa lahat ng various heads of our health facilities, our regional directors. On June 25, the same day po, and this was a Friday, we signed sub-allotment guidelines and we disseminated for guidance to all our health facilities, to our regional offices. And that during this time, June 25, we were still receiving po, Mr. Chair, additional requests for additional benefits for some health facilities po na hindi pa ho nakapaggawa ng MOA, Memorandum of Agreement. Again, sir, if we have to transfer funds to a private health facility or to an LGU facility, we have to have Memorandum of Agreement per our auditing and budgeting guidelines, sir. And then on June 25, we processed sub-allotment advice and disseminated to all health facilities. And noting that on June 30, the law will expire. So lahat ho na makakaya ho namin, ginawa ho namin para ma-disburse and makarating ho talaga sa healthcare worker yung karampatang SRA ho na dapat nilang ma-receive. So that's why yung explanation ho din kanina po na 9 billion, 9.7 exactly, 9 billion, 7 million was given to us as an allotment. However, again, due to time constraints po, we were only able to disburse with healthcare workers receiving SRAs amounting to 6.7 billion po. And that was done in a matter of 3 days, actually, sir, from Friday. Yun po, sir. And then, sir, one more slide, sandali lang po. For the compensation, again, this is one of the compensations due a healthcare worker. So dito po, ng honorable senators and our government officials, we were able to provide these benefits under Bayanihan 1, again, sickness and death benefit compensation, which is part of our RA 11494, from March 24 to June 24, 2020, we were able to provide 114 public and private healthcare workers who got sick, who died of this of COVID in the amount of 62.7 million po. And then Bayanihan 2 from September 15 to August 16, last Monday lang po. We were able to provide compensation to 23,331 healthcare workers amounting to 493.9 million po. Again, for a total of 556.6 million. Yun po, Mr. Chair, maraming salamat po sa pagkakataon na to. Thank you po.
I will recognize Senator Marcos shortly, and then of course, Mr. Mendoza. But ang sinasabi mo, Mylene, binibigyan kayo, huli na nga, kulang pa. Tama?
Sir, opo sir.
At pinagmamalaki mo, hindi naman insulting yon, sinasabi ko lang, pinagmamalaki mo, pinapaabot yung pilit, pero hindi nyo matapos dahil sa kakulangan ng panahon.
Tama po sir. Sir, hindi ho naman po pinagmamalaki po. Stating facts
Sorry,
lang po. sir.
I chose the wrong word. I apologize. Ang sinasabi
thank
mo,
you, sir.
hindi nyo matapos, di ba? Hindi nyo
Yes,
matapos
sir.
dahil kulang na. Tapos, ang problema pa, you are relying on the bureaucracy na kailangan may mga muwa pa kayo, di ba? Para mabigyan yung private sector, right?
Yes sir. Tama po yun sir.
Kaya you are dragging anchors. Kumbaga kung may dala kayong angkla sa leeg ninyo. Hindi nyo mabigyan.
Yes sir.
Ha?
Yes sir.
Okay.
Because we know we're using people's money and we want to be very diligent in the use of all these funds po.
No, you are very diligent because COA will go after you if you do not do that.
And yes, we know that also sir. We also know that sir.
Alam ko yan. Alam ko, galing ako sa gobyerno. Sa local government. So, ang point ko ngayon dito is, hata sinasabi mo magandang pakinggan, pero ang kailangan masagot sa committee, bakit hindi umaabot yung pera, sabi ng mga sa kanila. Yan ang gusto ko malaman at mamaya mangingi ako ng advice sa lahat ng senador at saka sa COA kung paano natin malalaman yan. Ako, I have an idea. But in the meantime, bago ko tawagin Secretary Mendoza, si Mr. Mendoza, Secretary Marcos, are you going to pursue the point or if it's another point, I will ask you to wait and let Mr. Mendoza answer the point.
Yes, thank you very much, Chairman Gordon. I'm going to proceed to another point, which is why please go ahead and
So,
ask
with
Mr.
permission,
Mendoza.
Mr. Chair, Mr.
Mendoza, no?
Chair,
Yes,
if I
sir.
may just
Hingin
10
ko muna
seconds,
Mr.
Mr.
Mendoza
Chair,
tandali,
10
ha?
seconds.
Para hindi tayo nahihiwalay, okay? And then you will have your point and then we will pursue that point. Okay? Now, Mr. Mendoza, go ahead. Joel, do you have something to say?
Yes,
Senator
yes,
Villanueva?
10 seconds, Mr. Chair, 10 seconds lang.
Okay. 10 seconds to shoot.
Yes, Mr. Chair, maganda ho yung sinasabi na presentation ng DOH. I just want to point out and spread it to the records. Ang bayanihan to ho passed September 11, 2020. So, if we are ready about it, nagawa na natin yun, naayos na natin, naplansya na natin yung mga dapat natin. I just want to point that out kasi hindi naman totoo na parang 5 days lang yung preparation at ayusin at i-disburse itong 9.02 billion pesos. I don't agree with that. Just want to put that on record, Mr. Chair. Thank you.
Well, those were my sentiments exactly. And I'm sure that's the sentiment of, I was looking at the COA chief. Talagang imposible talaga yan. Mission impossible. Di ba?
And we work hard for it, Mr. Chairman. We work
Correct.
hard for
Correct. Ibig sabihin, meron talagang inefficiency at kulang sa vision. Ang DBM, kulang sa vision rin. Ang Department of Health, dapat pinupukpuk nila yan. Oy, matatapos na, hindi nyo binibigay. Now, let's listen to Mr. Mendoza because kanina pa rin na gusto magsalita niyan. Gusto ko marinig natin ang nurses para pag natapos natin to, yung iba tatalakayan na natin, yung ibang mga kakulangan para hindi na masama ang loob ni Secretary Duque at malalaman natin kung guilty or not guilty siya. Okay?
Yes,
Mr.
po.
Mendoza, go ahead.
Okay, ano ba yun?
Go ahead. Are you ready?
Yeah, I'm ready.
Yes.
Sana yung ano.
Saan na yun? Ready ka tapos hinahanap mo.
Okay po yung audio ko, sir.
Sige po.
Okay. Ito po yung mga nasa government hospitals na lahat ng mga hospital ay merong nakatanggap, merong hindi po. So, pag-usapan natin yung special rest allowance na dapat 5,000 for 22 days. Other hospitals, kasi kinausap ng ating mga unions, ang mga director, na dapat lahat sana ay makatanggap kasi alam natin na high risk ang hospitals. Ito yung pinag-uusapan kanina. So, ang ginawa ng ating mga directors, diniklara nila na ang kanilang mga hospital ay high risk. Kaya lahat ng empleyado ng hospital ay nakatanggap ng SRA. Maliban lang sa ibang mga director na talagang sinundan niya yung batas, parang exclusive lang talaga daw, kagaya ng San Lazaro Hospital po, ang kanilang director talagang hindi binigyan ng SRA yung mga other health workers. except lang yung mga nasa COVID area. Pero dapat ginastify niya dahil infectious yung kanilang hospital, dapat ginastify niya na pwedeng lahat ng health workers ay pwedeng bigyan. So, kung isa-isahin natin ang mga hospital sa specialist allowance ay mayroon from ang PGH po, sinabi kanina ay ang kanilang area ng nabigyan ay yung COVID area lang. So, ang ibinigay sa kanila ay binigay sa kanila yung COVID area lang from September to June lang po sa COVID area. Pero yung September to December 20 ay naibigay sa non-COVID areas. Tapos, ang kanilang active hazard duty pay ay hindi pa ibinigay. Ang ibinigay lang ay September to December 2020. Ang kulang pa ng Department of Health ay from January to June 2021. So, ito yung mga kakulangan din po. And then, ang karamihan sa ating mga health workers ang may kulang pang Department of Health dahil 3 days after na ni-release yung budget para sa mga hospital para sa meal, accommodation, transportation, ay binawi ito ng Department of Health kahit hindi pa nagamit ng mga hospital yung kanilang meal allowance, accommodation, transportation. Like for example, yung si Reyes ay binawi ang kanilang budget for MAT, 56 million, ang Fabella ay binawi ay 59 million, ang Tondo Medical Center 20 million, ang National Center for Mental Health 62 million, at marami pang mga hospital na binawi po nila yung nirelease nilang budget. Kasi kailangan daw yan sa mga paggagamit, meron pa daw silang paggagamitan sa Department of Health ng mga para doon sa COVID response. Pero nung nakita natin ang COA findings, marami pa palang pera ang Department of Health at saka dapat ibinalik ito ng buo doon sa mga hospital po. Kasi ang ibinalik lang nila nung nanghihingi na tayo ay 30% lang doon sa AIDS, doon sa kinuha nila sa mga hospital, itong mga budget na ito. Kaya ito yung mga kakulangan na talagang may kulang pa talaga ang Department of Health doon sa pagbibigay ng meal, transportation at accommodation allowance. Kasi ang ibinigay lang sa kanila ay 30%. Saan napunta yung 70% for the accommodation transportation? So, nung siningil na natin ng Department of Health, sinabi nila nagamit na ito para doon sa COVID-19 response. So, ito yung mga, kaya nga dito sa unang pagbibigay po nagkalituhan ng mga director kasi hindi rin malinaw ang department order ng ating Department of Health kung paano ba ibibigay itong meals, accommodation, transportation. So ang iba ay nagbigay ng groceries, nagbigay po ng cash gift, gift check. Tapos sa itong ating pangungulit with the Department of Health ay sumulat ang Department of Health sa Office of the President at ito ngayon, noong June 1, naglabas na ang Office of the President na gawin ng cash equivalent. Kaya yung iba, nabigyan sila ng cash. Yung pinakahuli na po, lalong-lalo na yung mga nasa GOCC kasi obligated na yung kanilang mga pondo at natira pa. So ito yung hinanakit ngayon ng mga health workers kasi hanggang ngayon, dahil alam natin na may pandemya pa naman sa kasalukuyan, hindi pa rin nabibigay sa lahat yung kanilang mga meal, accommodation, and transportation from January to June 30. Ito yung sinasabi ng ating Department of Health na nag-request sila sana ay tuloy-tuloy sana ang mga benepisyo ng ating mga health workers. Kaya ito rin yung inaantay ng ating mga health workers from the public sector na dapat dahil may pandemya na, may Delta variant na, may Lambda na, sana mabigay ng tuloy-tuloy yung benepisyo ng ating mga health workers. Yun lang po. Maraming salamat.
Let me ask you a simple question before I go to Senator Marcos. Tama yung sinasabi mo, kulang ang binibigay, hindi pa umaabot, kaya maraming hindi nabibigyan. Tama?
Yes, tama po yan, Mr. Chair.
Alam ko ang problema ng DOH, gusto lang ibigay, kulang rin at hindi sapat. Tama?
Tama po.
At hindi nila mahabol dahil huli na binibigay.
Tama po yan.
Gusto nyo ngayon, hindi ba pwede, Secretary Duque, yung mga tao mo at saka ito mga asosasyon ng mga hospital nurses at yung mga tao yan, meron kayo talagang committee para sabayin yung ginagawa para walang malalampasan. Hindi yung ngayon na lahat nagke-claim hindi sila nabigyan. Hindi natin malaman ngayon kung ilan talaga hindi nabigyan. Dahil kung kasama nyo lahat yung association, madali natin malaman kung sino ang nabibigyan at hindi nabibigyan. Pwede ba yun? Sir, sa inyo side, Mr. Mendoza.
Yeah, tama po yun. Dapat kasama sa mga pag-uusap yung ating mga hospital unions kasi alam naman natin na part tayo doon sa kabuuan, mas malaki ang ating kasama sa rank and file. Dapat kinukonsulta din dapat ang mga hospital.
Hindi kinukonsulta. Ito, sasabihin sa inyo, ito ang pera namin. Kasama kayo dyan, ito ang bibigyan. Ito mabibigyan, ito hindi mabibigyan. So alam nyo na kagad, magpapaliwanag na kayo. Pwede nyo i-prioritize. Saka na muna yung hindi kailangan, yung laundry or whatever. Unahin natin itong maibibigay para meron kahit na paano. Pwede ba yun?
Pwede po yan para mas maganda po yung yung daloy ng pagbibigay ng mga benepisyo sa mga health workers. Baka pwede, Mr. Chair, baka pwede magsalita si Ma'am Karen from PGH po.
Yes, of course. So, teka muna, kayo tinatanong ko, ikaw nagsalita eh. At tatanungin ko ngayon, Mylene at saka si Secretary Duque, have you tried working with the nurses para hindi kayo nakakagalitan at hindi kayo nasisiraan? Dahil kung kayo, kinakausap nyo sila, malayo pa, nakikita nyo na yung problema na hindi umaabot, di ba? Hindi nasisiraan ang tiwala ng tao sa gobyerno dahil alam nyo, yung bibigyan nyo, kasama nyo, at alam ng mga tao nila na ginagawa nyo lahat ng paraan na malalaman nila kung kulang talaga yung pera. Tama ba yun, Secretary Duque? Pwede ba yun?
Tama naman yun, Mr. Chairman. In fact, doon nga sa provision ng meals, no? Ako po ang sumangguni sa Office of the President na nakipag-meeting ako sa Alliance of Healthcare Workers para kumbinsihin ang OP na yung provision of meals, hindi lang yung pagkain. Kasi napapalisan nga nabubulo. Siyempre, duty sila. At tagal-tagal nila sa mga trabaho. Tapos, pagka hinanda yung pagkain nila, kawawang-kawawa naman po sila. Kaya,
Secretary Duque, you're straying. All I'm saying is have a working relationship so that the people that you're supposed to serve, malalaman nila dahil may representative sila doon, nag-uusap kayo, hindi nagko-consult ha. Alam nila itong pera, itong darating, kailan darating, at kulang ang binigay para hindi masisisi lahat kayo. Para kung kapos sa DBM, yun ang hahabulin. Tama ba yan?
You're right, Mr. Chairman. Nakikipag-meeting naman po yung akin Chief of Staff, si Undersecretary Bong Vega and Assistant Secretary Romy Ong. So pinapaliwanagan naman po sila tuwing andito sila sa harap ng Department of Health at kinakausap po sila at pinapaliwanagan po sa kanila kung ano po yung talaga mga kakulangan.
Hindi nga, pagbigay alam nila at masasabi nila sa mga miyembro nila. Anong tataka ako? Bakit sasabihin ng San Lazaro, katabi nyo lang yan, hindi nabigyan? Totoo ba yan?
Nabigyan, we have the document to prove that San Lazaro received their SRA, their benefits, no? So we can just send you all the documents in the list of those who accepted or received the
I
benefits.
strongly suggest, tawagin nyo sila, yung mga San Lazaro, at paliwanag nyo sa kanila, marinig namin, ito, nabigyan na kayo niyan. Ayan. Para malalaman, marami yan magkakaroon. We don't have the time to do that, but you really have to make sure that you do your homework and they do their homework para hindi mabigyan, mahahabol natin kagad. Alam natin kung sino hindi nabigyan. Tama ba yan, Mr. Mendoza? Okay ba yun?
Tama po yun. Meron po tayong nurse from San Lazaro. Baka pwede siya magsabi. Si Ma'am
Sige.
Jenny.
Sabi mo, sino yan?
Po, Ma'am Jenny de Guzman.
Jenny de Guzman, please speak up. You're on mute. You're on mute, Jenny.
Naka-mute.
Yes, Your Honor.
Go ahead po.
Yes po. From San Lazaro Hospital, meron pa po kami as of now naka-pending na request, additional budget for the SRA, especially sa mga nurses namin na nabigyan yung iba pero small amount, hindi yung complete amount ng SRA ang natanggap nila. And wala pa pong balita kung ano ang status nun from DOH, kung maibibigay pa ba siya o hindi. So, malinaw po kasi na napakaliit ng time po na binigay.
Jamie, kung 100 ng nurse doon, ilan ang nabigyan sa tingin mo? At kulang pa?
Yung percentage po, let's say maybe 80% ng nurses, or let's say 90% out of the 400 plus na mga nurses, yun yung mga nakatanggap lang.
So nakatanggap?
Kasi
10%
po,
na lang hindi
so much,
nakatanggap.
Sir, Your Honor, kasi ang dami po talagang attachment and it made us difficult to justify Ang hirap po na humingi ng benepisyo nakalagay sa batas pero ang dami pong dapat ipaliwanag na kailangan pang i-justify namin na i-justify kung bakit kailangan makatanggap when it is obvious na talagang sa patient care naman yung mga nurses. And aside from that, yung nabanggit niyo po, Sir Gordon, yun sa ambulance driver po, wala pong nakatanggap na mga taga-ambulance driver. Talagang piling-pili lang.
Kaya nga
The
sinasabi
director was afraid to justify.
Kaya nga sinasabi ko po, mag-usap kayong maigi para pag ito na yung pera, masasalansan na yan at kung sino mabibigyan, malalaman natin kagad at bakit hindi nabigyan yung hindi nabigyan.
Mr. Chair?
Okay with you?
I agree po, Senator. At saka sana po yung pakikipag-usap namin sa DOH, hindi yung laging kami yung nagre-request ng dialogue dahil meron kami reklamo. Tama po yung suggestion nyo na prior to that, na bago pa magkaroon ng issue, sana po may consultation na, may committee na members ang mga health workers para meron na kami agad say.
Yung in the period of the pandemic, meron ka talagang office na araw-araw nakikipag-usap dyan sa mga, yan na, hindi na sila makikipag-appointment. Di ba, Secretary?
Yes, sir. Yeah, yes, sir. We will do that. We will make sure that there will be a regular meetings and consultations with the
Bukas palagi, para kung may magko-complain na andun, malalaman ka agad and then re-reviewin ng alliance kung sinong hindi nabibigyan. At masasabi ngayon formally sa inyo na hindi kami nabibigyan, yung mga drivers namin hindi nabibigyan. Yes, Senator Papangilinan?
Yes, very quickly before we proceed to another item, may dalawa kasing hindi nasagot sa tanong ko at meron pang isang tanong on that matter. Siguro yung unang tanong, can the DBM confirm and explain bakit June 25 nila binigay yung hinihingi sa DOH? Ipaliwanag po nila bakit ganun. Do they confirm that and explain why? Second, so hindi totoong hindi nag-apply yung mga private hospitals. Hindi pala totoo yun. Ang totoo, nagbigay pero hindi kompleto o hindi o kulang yung ibinigay na sinasabi ni Ms. Director Blando na 5.8 million, 7.2 million. Tama po ba yun? Clarify lang. Kasi sinasabi nung ating mga yung alyansa ng health workers, ang paliwanag, kaya daw wala, ay dahil hindi nag-apply yung mga private hospitals for these benefits.
Sir, may the chair allow me?
Please go ahead. Go ahead.
Yes, sir. Just to clarify the previous timelines that the ASEC from DOH mentioned, the AO, actually sir, yung 13.5 billion lang ang release out of the request. Yun po kasi yung nakalagay sa batas. So we are limited by the law itself. So we release what was included in the law. So 13.5 billion po yun. Ni-release po namin buo yung 13.5 billion. After that, sir, nagkaroon ng AO because may limitation yung pagbigay ng SRA. So nasubmit po yun ng June 1. At nailabas po yun ng DBM, nailabas po ng June 1 from the Office of the President. June 3 ho, natanggap ng DBM yon. At pinirmahan din ho nung araw na yon nung aming previous secretary. Umabot po ng June 16 sa DOH, pirmahan yung joint circular. Pagkatapos po nun, ang submission po nila ng request is June 23. So, hindi naman ho kami pwedeng mag-release without the request. So, ililinaw ko lang ho yun dahil yun ang kulang dun sa pagsasaad ng kwento ng taga-DOH that they submitted the request on June 23. Being a holiday June 24, we released the document but it was antedated to June 25. So, yun lang po yung kulang dun sa kwento just to put things in the proper perspective. Thank you, Your Honor.
But obviously, you're all victimized by bureaucracy.
Yeah.
And that can be solved.
Yeah.
That can be solved, right? Madam Secretary? Future Secretary?
Yes, sir.
Yes, appointed, right?
Yes, sir.
At
Okay.
yung pangalawang tanong lang, Mr. Chair, yung ano ba talaga yung dahilan? Iba-iba yung sinabi kasi ng alyansa na hindi daw nag-apply yung private hospitals para dun sa special risk o yung allowance, pero sinasabi may ni-release naman daw, sabi ng DOH. So ano ba ang totoo is hindi nag-apply, nag-release,
with the permission of with the
Mr.
permission of
Chairman.
everyone, may I be given 5 minutes to withdraw for a while? I just have to have a commitment in my office. And can you handle it, Senator Kiko? Unless you want me to suspend, can you continue with the hearing para hindi tayo masayang?
Yes, please. With the permission of our other colleagues. Anyway, the majority leader is here. He can preside.
As my vice chairman.
Kiko is a lawyer. I think he'll be aptly capable of running the Blue Ribbon Committee, and of course, while waiting for the chairperson.
We
May I
will
recognize the Mr. Chairman, presiding officer.
we will take over for 5 minutes as requested by the Blue Ribbon Chair.
I appreciate it very much. Thank you. Please don't forget to recognize Senator Marcos because I'm sure it's not
Yes.
my son.
On
Thank
the
you.
same issue lang, Chairman, on the same issue lang.
Go ahead, Senator Zubiri.
Yeah, thank you for for everybody's information. I was able to get a letter from a friend of mine, Dr. Jose Rene de Grano, the president of the Private Hospitals Association, chairman. And I had asked him, we spoke for a long time last Monday evening, and he wrote to me. I asked him to write me formally. And this is the result of his interviews with all the private hospitals. So he says here, when Secretary Duque mentioned in his interview that the benefits of healthcare workers are already with the different hospitals, I tried to ask, and I'm quoting, I tried to ask some of our members in the different regions if it is true. I found out in Region 1 and 2, a lot of hospitals have already received their SRAs, in fairness. Second tranche, although some were not able to apply for the first tranche. In Region 3, and I think Senator Villanueva would be interested in this, in Region 3, Bulacan hospitals have not yet received their SRAs, according to his survey. A lot of them were not also aware of the benefits. And then in Calabarzon area, most of our Region 4 hospitals, if not all, in Batangas, Quezon, and Laguna, have not received their special risk allowance, mainly because these are being held in the DOH regions or provincial offices and have to pass through the LGUs before being distributed to private hospitals. The daan pa ng LGU. Some hospitals in Samar and Leyte have not received also their special risk allowance, Region 8 particular, while some hospitals in Region 6, Iloilo area, have received first tranche and second, no report on Region 7. Although we've spoken to people in Panay Island and they still have problems there. In Mindanao, Region 12, hospitals, according to Dr. De Grano, also have not received their SRAs, and they say it is still with the DOH region or provincial offices. And they were informed that the checks were ready for distribution. Same is true with Zamboanga hospitals. So clearly, it's a bureaucratic mess, Chairman. And finally, the last two paragraphs. Most of the government facilities and hospitals have received their SRAs, especially in the NCR. So sa gobyerno ng hospital, nabigay na po daw itong mga SRAs according to the dear doctor. Most of the hospitals in NCR have also received their SRAs, although we saw the complaint given by the St. Luke's union. The question is, why does the SRA, the special risk allowance, have to pass through the LGUs? According to the doctor, imagine the LGUs have to make a board resolution. In other words, I guess it's a council resolution, and another MOA, with the private hospitals before releasing the SRAs to them, notwithstanding that the MOAs that we are giving the DOH provincial offices. So some hospitals have been waiting for weeks for the LGU to act on the SRA, special risk allowance. The funding comes from the DPM, and the question is, why does it have to pass through the LGU and not directly to the DOH, to the private hospitals?
Okay.
So, siguro yun ang tanong, Secretary Duque and Mr. Chairman, why do the funds have to be also given to the LGUs directly to the private hospitals? May we ask that question, Mr. Chairman, to the
We
department?
have the secretary or his representative who may be able to answer that, those series of points raised by the majority leader. And my question also, that they did not apply, or these private hospitals did not apply. That's why they did not get the allocation. Can that be clarified, please?
Yeah, thank you very much, Mr. Chairman. May I ask that you please recognize Director Gloria Balboa of NCR CHD to answer your question, and then the next one will be Director 4E, Director Ed Hanaygo So si
Okay.
Gloria Balboa po na, Mr. Chairman. Salamat po.
Go ahead, Director Balboa.
Yes po. Good afternoon po to everyone, Mr. Chair, and of course, Sec Duque. For NCR po, for the second tranche, we were able to release to 90 private and public hospitals po and laboratories. Out of this po, 69 are from the private hospitals, and then 4 private laboratories, and all our local government unit hospitals are able to receive in cash po on June 30. So nabigay na po lahat yun, including those that I've mentioned in the chat box. And we were able to release a total of 901 million plus po in a matter of 3 days. Okay, now it is, let me just emphasize that the list of beneficiaries came from the health facilities, from the hospitals. Sila po ang nagsubmit sino yung mga eligible beneficiaries based on the guidelines of DOH and DBM. So whatever they submitted to us as the number of health workers together with the corresponding amount, yun po in full binigay po namin. So it is possible that those who are saying that they have not received, hindi po kasama doon sa list that was submitted to us. But we provided that money to their hospital. Okay. And then, meron din pong mga hindi po nag-submit on time because the deadline was June 30. So there are still 16 facilities that we requested additional funding kasi nag-lapse na nga po from DOH and DBM. And also, there are still 5 facilities which have already received but have requested additional dahil meron daw idadagdag doon sa list. And just the same, we have requested that to DOH Central Office and to be submitted then sa DBM. So hinihintay pa po namin yun, sir. So that's what happened po sa NCR.
Thank you, Director Balboa.
Just to add, ang sako po ng NCR are of course the local government units under NCR, 17 po yun, together with all their LGU hospitals and all the private hospitals. So yun naman pong DOH hospitals ay sa kwan po sa DOH Central Office po. So
Okay,
yun po sir, thank you.
Thank you, Director Balboa. Just very quickly, the next one to present would be direct for the rest of the country. Yung questions raised by Majority Leader. Who is the director again? Who is the next director? Okay, go ahead.
Actually, directly answering question or issue, we can only transfer funds from the national government to the local government through a memorandum of agreement. But the problem there, they have to go under a process. Sa sanggunian, they will have to allow the governor, kasi sila yung may-ari ng mga district hospital eh. So they have to allow the governor to sign. So that's one. Now, with the private hospital,
Chairman, just for clarity, Mr. Chairman, Director, the funds that we're talking about are for private hospitals. I understand there are local government-run facilities, just like Bukidnon, meron po kaming marami. But I'm talking about the private hospitals here. And they're wondering why, bakit pa dadaan sa local? Is it true? First, if you can answer the question, is it true for the provinces that the funds for the private hospitals are given to the local government units for disbursement? These are for privately owned hospitals.
it's not happening in Calabarzon. We go directly to the private hospital memorandum of agreement. And still, they have to undergo a lot of process also before they can agree with us.
Okay, Director, nobody yet is answering my question about the LGU. So in Calabarzon, what you're saying, Director, kayo sa Calabarzon DOH ang pondo, binibigay nyo sa private hospital directly. Tama?
Directly,
Tama
right.
po yan. And whether it's LGU run or private hospital. Bakit yung complaint ng ating presidente ng ating private hospitals, Private Association of Hospitals of the Philippines, say that in other regions, particularly the far-flung regions which I mentioned earlier, the Mindanao regions, together with Region 8 and other regions, it's still with the local government units. So who can answer that, Secretary?
Secretary, go ahead. What is
Yes, Mr. Chairman, thank you. May I request that Director Annabel Yumang answer that question? Director Annabel Yumang, please recognize Mr.
what is her
Chairman.
designation? Just so that we know.
Regional Director, sir.
Region 11.
Region 11.
Yes, but we're talking of all these regions, not just Region 11. We're talking of the entire country. We cannot have every region explain their policy. What is the national policy, Secretary?
That's why, Mr. Chairman,
yes.
we just want to ask the Secretary what the policy is, because in some regions, apparently from the regional office direct to the private hospitals, kaya mabilis ang proseso. Pero meron po mga regions, apparently, na pinapadaan pa, and you can confirm or deny this, but the people from the Private Hospital Association are saying na dumadaan pa sila sa LGU, kaya dumadaan sa butas ng karayom, kasi kailangan pa daw ng, of course, the LGU will have to come up with the board resolution, whether it's the provincial board or the city board. So,
Yes.
tama ba yan? Proseso na yan?
Mr. Chairman.
Can we just have the Secretary clarify what is the policy? Should DOH funding for private hospitals go through the LGUs or not?
No, Mr. Chairman, no. Have to go straight to the private hospitals, Mr. Chairman.
Okay, so if that's the case, then you have to check with your field offices, because there are reports that some areas, the DOH downloads it first to the LGU or requires the LGU's participation when the funds are allocated for private hospitals. I think that is the simple action that should be taken, and therefore maybe a directive be made to ensure that all private hospitals need not go through local government memorandum of agreement when it comes to funding private hospitals with respect to the special risk allowance. Tama po ba yun, Secretary?
Tama po kayo. Tama po kayo. At malinaw po yung aming policy dyan. They don't need to go through the LGU. Diretso. Wala namang katuturan yung pagkakanin mo pa sa LGU.
Kumare, and with the permission of the majority leader, perhaps he can turn over the letter of the president of the Private Hospitals Association so that maliwanag, kwentas claras. Kasi ni-report na eh.
Yes, sir.
Siya na lang ng Office of the Secretary.
Immediately to the committee and to the Secretary, Mr. Chairman, as well as just to add to what the Regional Director of the DOH Region 4, sabi niya sa Calabarzon, wala daw silang problema. I just want to put on record, a doctor friend of mine texted me last night and says, without naming names anymore who it is, I'm a practicing doctor here in Tanawan City, Batangas. We operate a small 45-bed capacity level in the city, sir. I presently stand as medical director. We have, just for the record, Mr. Senator, we have not received a single special allowance from local government or DOH po, sir. All the best to you and your family. Please, I hope you can help us with this. So yan. Kaya nga, ang gulo, he said, she said eh. Diba? Nasa news na sila, umiiyak na sila. Ano ba talaga ang totoo? Can we get the, we will have another hearing. We will get to the bottom of this. If they want sworn statements from this hospital, let's produce sworn statements. And obviously, there is an inefficiency of the delivery of these allowances. There must be something wrong in the process. Imagine the president of the Private Hospital Association complaining na dadaan pa ng LGU. Ibig sabihin talaga yan ang proseso sa ibang hospital na siguro hindi alam ni Secretary. Diba? So, Mr. Secretary, maybe you can look into this. And in the next hearing, we can come up with a clarity on the situation. Maybe that's the reason.
Thank you, Mr. Chairman.
Mr. Chairman, Mr. Secretary, maybe that's the reason for the delay. It's not your fault, Secretary. But maybe because of this so many due process, di ba, I'm the author of the ease of doing business. Because of all of these layers and layers, kang kawawa yung mga nurses. Talagang kawawa po sila. Abot ng buwan bago dumating sa kanila. So thank you, Mr. Secretary.
Thank you, Majority Leader. We will now recognize Senator Marcos, who has been waiting quite some time. Unless she's willing to... unless she's willing to yield to our other colleagues who might be raising points on the issues earlier raised. I will.
Thank
Go
you.
ahead, Senator Marcos.
Thank you, Mr. Chair. I wanted to wind up this subject matter because what's most alarming financially is the fact that this unobligated amount of 11.89 billion is not only nationally funded, inutang pa natin yan. A big part of that is constituted by foreign loans. So perhaps what we need to do para tahakin natin yung way forward, alamin natin ano ba talaga ang mga amounts na yan. Because there's a laundry list provided in the executive summary of the COA report as well as random listings from DOH from the special risk allowance and then the hiring, pero meron pang PPE, magulo siya, may ventilator, may mga HFEP, halo-halo, masalimuot. Can we request, in as much as there's going to be another hearing in any case, that we get a proper listing and a breakdown of the composition of said funds and also the status presently. Kasi hindi matatapos ang usapin nito. May utang tayo sa lahat ng health workers, katakot-takot. So yun na, i-meeting na yung mga health workers kung magkano talaga ang ine-expect nila at gawing maliwanag at transparent yung proseso. At sa kabila nun, alamin na natin dun sa 11.89 billion na flinag ng COA, magkano pa ba talaga ang natitira? Para alam nila na may pera naman. Huwag na natin sagutin na kulang yung pera, magulo yung proseso, nade-delay. Hindi ba pwedeng tapusin na natin yung usapin na yan, hingin sa DOH at sa DBM, magkano yung perang natitira dyan sa mga unobligated na funds na yan, and at the same time, magkano ba talaga ang kiniklaim ng ating mga hospital at health workers?
Okay,
Mr. Chair.
with that manifestation, we are asking the Secretary of Health
Mr. Chairman, we will
coordinate with the
comply.
Secretariat. Just let me complete so that the breakdown of the 11.85 billion is submitted, and we will be requesting that be answered in the next hearing that will be conducted together with the DBM. So the DBM and the DOH will confer prior to the next hearing and submit to the committee. We are requesting them to submit to the committee the breakdown of this 11.85 billion as earlier manifested by Senator Marcos.
We will comply, Your Honor. We will comply, Your Honor.
Okay, thank you. Thank you, Senator Ontiveros and then Senator Villanueva.
Thank you, Mr. Chair. Just to add my voice to that question previously posed by Sen. Aimee, no, ano ba talaga yung current status ng close to 12 billion pesos na yan appropriated for the special risk allowance at saka hazard pay ng ating mga health workers? Kaya pa ba itong i-obligate or hintayin pa ba natin ang budget season uli? And there's a particular urgency to this question, common question sa atin na Mr. Chair dito sa committee ito, because nababalitaan natin na out of desperation, no, yung kanilang desperate situation, may napipinto tayong mga kababayang healthcare workers who have not received what is due them, na nasa bingit na ng pagbibitiw or kaya lockout or parang pagwewelga simply because they're almost at their wits end. Kahit dito po sa chat group, Mr. Chair, napaka-poignant na mga ine-express nila, halimbawa yung sobrang distorted na ang buhay nila bilang healthcare workers, pati ang usapin ng work-life balance. Kaya particularly urgent, Mr. Chair, malinaw sa atin ng DBM at DOH ang status ng halos 12 billion na iyan at kung posibleng mamobilize yan in timely fashion as in ngayon para simulang i-meet yung obligations ng national government sa ating healthcare workers. Baka para sa ilan sa kanila, that might spell the difference between taking that last desperate step or being able to survive at mag-survive ang kanilang mga pamilya a little more, Mr. Chair. Salamat po.
Yes, hihirit lang ako kay Senator Risa. Just like our chairman, Angara of Finance, I'm of the belief that said amounts can be available for use throughout 2021 and
Yes.
as long as the pandemic persists. Habang may emergency,
Yes.
pwedeng gamitin at i-access yan. Hindi totoo na naglalapse lahat at wala nang gagamitin pagkatapos ng June 30. Palagay ko, tuloy-tuloy yan kasi hindi naman rini-rescind o rini-revoke ni Presidente ang status ng emergency.
Thank you, thank you. We now yield the floor. The chair, Senator Gordon is back. Thank you, Mr. Chair.
Mr. Chair.
Thank you, Brad Kiko. Thank you very much. And thank you, Aimee. That was a very good suggestion. If I understand you correctly, dapat ka tuloy-tuloy na itong law na ito para hindi na tayo pabalik-balik. Kung kinakapos, tuloy-tuloy na dahil ayaw natin nabibitin yung mga tao, di ba? Dapat meron tayong revolving fund. We'll see what we can do about the aid and legislation.
Mr. Chair.
And then, Mr. Chair, I'm going to ask my questions.
Go ahead, Aimee. Go ahead, Senator Aimee. Go ahead, please.
Joel yata. Okay lang. All right. Well, it's still about the special risk allowance.